Welcome back, you guys. Thank you very much for joining me. My name is Swadik Mayanja, and I am Q the Nurse. And on this channel, I bring you news, research, fun topics, and current events that matter to nurses everywhere. Today, we've got quite the list of stories for this week in nursing news, so stay tuned.
Better to have a short life that is full of what you like doing than a long life spent in a miserable way.
Hey! So jumping right in for the first story of the day, going in the same path of my everyday heroes. And for most people who don't know, I started that interview series, Everyday Heroes Show, just because I believe nurses are everyday heroes. And on top of that, I wanna open that lane to all the other professions and all the other average Joes and average Sallies in the world that don't get the spotlight they deserve. And today, we're talking about more nurses and the heroic shit they do, specifically in South Korea. So the first story, there's a video that came out of a group of nurses that literally just jumped and sprang into action when there was an earthquake in South Korea, saving some babies' lives. Like, the earthquake's happening, huge earthquake, the entire building is going from side to side, up and down, back and forth, and these nurses are like, you know what, forget about me, forget about my coworker. They didn't say that. And they just sprang to action. They ran to go save these babies. Alright, so a video has surfaced showing what looks like a group of superheroes saving newborns during an earthquake. Within split seconds, the team grabs and protects every baby in the room. There are about 20 babies, 6 adults, and the bassinets are on wheels. The video was shared by CBS news station in South Korea, where the 5.4 magnitude earthquake struck on November 15th. The nursery was built to withstand an earthquake of up to 6 magnitude. These nurses, however, were built to withstand anything. Ooh, South Korea, I love that. I love that. Nurses were built to withstand anything. And it's true. So just understand, like, if you're a nurse, and for all you nurses and healthcare providers out there, you know the protocol. The protocol is if an earthquake happens, so first and foremost, check out the video because it's really super badass. Look at this video. See what these nurses are doing at the time of crisis.
돌보는 직원들, 지진이 강타한 순간 건물이 요동치는 와중에서도 직원들은 제멋대로 움직이는 아기 침대부터 부여잡았습니다. 행여 뭐라도 떨어질까 온몸으로 아이를 감싸 안습니다. 놀라 달려온 산모들이 자기 아이를 찾느라 아우성치는 순간에도 침착하게 안내합니다. 외출한 산모의 아이들은 안전하게 조끼에 챙겨 나갑니다. 부쩍 쌀쌀해진 날씨에 덮을 것도 빼먹지 않았습니다.
So when you watch this video, you say, oh, well, this is super, like, it's good, it's important, I feel like I would do this. But if you do know, if you're in healthcare, if you work at a hospital, you know that the protocol is when there's an earthquake that's happening, the last thing you want to do is run from one room to another room. You want to stay in the room where you're at, you want to make sure that the patients are safe, but you also want to stay and get covered, stay away from doorways, stay away from falling objects, because you yourself don't want to also become a victim. But it's just obvious to me in the video, the nurses that weren't in the nursery, because there was 3 nurses in the nursery for the 20 babies. The 20 babies for 3 nurses is impossible. You see one of the nurses try to grab all the bassinets together, which I think good for her, smart lady. But you see the other nurses just sprint out of wherever the hell they were. I don't know if it was a meeting room or another patient's room or another, whatever they were, they sprint that out. And I think it's all instinct. You're not supposed to do that because worst comes to worst, you know, there's these protocols for a reason. If something were to fall off, if the building were to shake and one of the tiles from the ceiling were to fall off, these nurses would have been victims and it would have been more of a problem than just going to help the babies. But if you're a nurse, you care, there's compassion. So your instinct says, I'm going to go save the 20 babies. So, I'm not telling you not to follow protocol, but I am shining a light on these superheroes on what the hell they're doing every single day. And like I say, I feel like I say this on every single one of my nursing news, but L&D is the goal. And these nurses are the reason. Like, look at this. How can you just not think of these cuties when you're an L&D nurse? How can you be like, you know what, I'm going to just stay right here in the office and let the 20 babies be taken care of by the 3 nurses? Remember, these nurses can withstand anything. So, South Korean nurses, congratulations, hats off to you. You guys are awesome. I absolutely love it. Heroic shit. Moving on, story number 2. So these are the 5 things, and I love this. Okay, so first and foremost, nurse.org. I get a lot of my stories from the blogs that they post over there. So I'm gonna permanently leave a link to nurse.org down below. By no means necessary am I getting paid by them or whatever. Absolutely not. I'm just saying I take a lot of stories from them, and it's wonderful. Nurse.org. It's basically, I'm a video format of nurse.org at this point. The amount of stories I use from them. So this week is 5 things that nurses need when they walk into the isolation room. And this blog was posted by, and there was a video that I will show you along with the blog that Blake the nurse, Blake Lynch, and he goes by Nurse Blake. I'm going to put a link down below for his YouTube channel, and I'm pretty sure he blew up with that first day of nursing school dance video that I'll put somewhere here. But anyways, he's a super cool guy. He's on YouTube as well, like as I am. Go follow him. I love it. Nurses forever. But the blog that I'm talking about today is the 5 things nurses need when they go into an isolation room. And for all you nurses, you know the struggle. When you walk into an isolation room, you know, you need to either be prepared or you need to be in and out real quick, right? So, but every time you go into an isolation room, there's always, and it feels like absolutely always, you never go in there and you tell yourself, you know what, I'm going in, I'm going all prepared, I got all my dressing supplies, I got all my med supplies, I got everything I need to get in there, do all my work and get out. The second you step in there, the second you tie up your gown and put on that mask, you're like, oh shit, I need A, B, C, and D. So these are the 5 things. If you want to just take note of them to remember to take with you every time you walk into an isolation room. Number 1 is stethoscope. And this one is super important for me because at my hospital we were told not to use our own stethoscopes because we use the disposable stethoscopes that are in the room. But if you're the first person to go in there, there's no disposable stethoscope in the room. And a lot of nurses who go in there and see a disposable stethoscope, in fact, we're supposed to leave it so they can use it the entire time. A lot of nurses, a lot of people end up throwing away the disposable stethoscope, which means the next person that goes in there without a stethoscope needs a stethoscope. So let's do this together. We're either all going to take in our own stethoscopes and clean them after, or we're going to leave the disposable stethoscopes in the room so we can use it until the patient is either off of precautions or they leave. Like, let's make a decision as a nursing team here and let me know in the comment section below. Number 1. Number 2, the next thing you want to remember is flushes. And this is super important. And it's super funny because you always come with all your meds ready, right? You're like, okay, I'm good, I'm ready. And then you go in there, you're like, ah, shit, I need to flush the IV, I need to flush the catheter, I need to flush whatever the 9,000 things that you need to flush as a nurse. You always need flushers. Make sure you have a couple in your pockets, make sure you have a couple with your meds, make sure you have a couple in the room just to make sure it's there, right? So flushers, super important. For number 3, he put just a normal saline bag because he says usually, I don't know if he works in a cardiac or a more acute facility than I did. For me specifically, yes, normal saline is a huge thing that you need, but I also thought that bringing in your meds, and I think this is huge for me, not the meds that are scheduled, his 2 o'clock meds or 8 a.m. meds, no, I'm talking about them PRN meds. Those PRN meds get me every single time. I go into the room with all my meds ready, and I'm so happy. I'm like, finally, thank God, I got all my meds. And the second I turn around, I talk to the patient, and he's taking his meds. He's like, you know what, Q, I think I feel a little something back here. I'm in a 9 out of 10. Can I please get that? Whatever. Oh, I'm feeling so anxious. Can I please get that out of? Oh, and you're like, ah, shit, help me, God. Now I'm gonna have to go out and gown to get the med, to come back to re-gown, to just give you one. So please stand by the door and ask a patient, are you feeling anxious? Do you need any pain meds? Do you need any sleeping meds? Whatever PRN meds you need to bring, please bring them. And with all those meds, a lot of my patients need like crushers because they take their meds with thing, or if you need the applesauce with the meds, so just make sure make sure when you're looking at your patient in the isolation room and you're at the doorway, go down your list and say, I got this, I got all my meds, he's not in pain, he's not anxious, he doesn't need any PRN stuff, he's had a bowel movement in the past couple of days. All of these things you need to go down the list, because if you don't, I promise you, you'll be in and out, out and in and out, out and in and out 1,000 times for that one goddamn med pass. Moving forward, number 4, wipes and bed sheets. So let's be real here. 9 times out of 10, if you're on precautions, you're on precautions for C. diff. C. diff heaven. My goodness, everywhere I go, there's more C. diff patients than there are patients without. It's impossible. And this one, I don't blame us nurses as much. Because when you have C. diff and you're pooping every 5 to 6 minutes, that means you're changing the sheets every 5 to 6 minutes. And you can't blame me if I forget to bring in the sheets if I just changed you an hour ago, right? I don't expect the sheets to be messy. I don't expect me to need 4 bags of wipes per nursing shift. It's insane. So this one, I give us a pass just because it's hard enough. It's hard enough to be going in there all day and staying in there all gowned up and sweaty. Those gowns suck. I don't know what we need, but we need some better gowns. And last but not least, the alcohol swabs. The alcohol swabs, this is super important when it goes back to the stethoscopes, because you need to wipe shit down. You know, especially when you go in there and there's poop all over the place, when they C. diff all over the place, you want to make sure when you leave, you clean yourself up. If you want to wipe down the shoe that you stepped into, the mess that was on the floor, if you want to wipe down the table, if you want to wipe down the stethoscope, you got to wipe shit down when you're leaving a precaution room, especially if you need to use a bladder scan or whatever. If you need the Clorox wipes, you need the Clorox wipes. But if it's just the alcohol swabs that you need the alcohol swabs. And it's also helpful when you are giving your insulins and your injections and all of that stuff. So make sure you have them. And then just to go down the list one more time real quick. So make sure you have your stethoscope. You got to do your assessment. You got to take care of the patient just like everyone else. Just because they're on precautions doesn't mean you don't need to listen to them lung sounds. You need your flushes. You need your normal saline bag, and you definitely need the meds and everything that comes with the meds. I'm talking about the crushers. I'm talking about the applesauce. I'm talking about the tube that goes down for the feeding tube patients. All of that stuff. You need the wipes with the bed sheets in case, most likely, if they have C. diff. And last but not least, you need your alcohol swabs to clean up after the mess. So those are the 5 things you need when you walk into a patient's room that has isolation. Those are the 5 big ones that most nurses forget and stand at the door and say, oh, could you please help me and grab me? So let's make sure we try to stay on top of that. And then moving forward, and this is an exciting story. This is a story for all you nurses that have been nursing for a little bit, or you new nurses that are trying to make that big bucks, that cash money. So this is another off of nursing.org, and is 6. They have 6. I'm going to talk to you about the 4. I'll let you know what the other 2 are, but they're talking about 6 nursing jobs that you don't need a master's degree for. You don't need to get your doctorate for, but these are the 6 nursing positions you can get with some experience that pays really, really, really well compared to other nurses. And I'm doing this off of the average of $43 an hour on a med-surg in a hospital. So that's based off of that number, okay? I don't know where you live or what the rate is for nurses where you live, but this is what I'm basing it off of. And it's off of nurse.org, and this article was by Angelina Gibson. So they talked to Michelle Brudigan, Vice President of Clinical Services at Fast Staff, a nurse recruiting agency that places nurses every day in many positions. So they do know, and it's their job to know prices and rates and how much and the average per nurse. So I think just let's get to the money. Let's get to the money. All right. So so we're gonna go backwards from 4 all the way up to 1. So for number 4. The 4th most highest paying job for nurses that is not necessary to get a master's degree or a doctorate degree. Number 4, cardiovascular intensive care unit. So finding a strong ICU generalist may be perfect for many community hospitals, but we find the larger medical centers are often looking for nurses experienced in receiving patients directly from the OR. Nurses who can recover a fresh heart and are comfortable with high specialized devices like VADs, ECMO, balloon pumps, and even Swan-Ganz catheters are especially hard to find. You better believe. You better believe. I mean, that stuff is serious. Okay, let me just let y'all know something. I'm going into cardiac, my first hospital job of going into a cardiac unit. And I'm super excited because a lot of these positions are cardiac specific. We haven't talked about the others, but they are. So with the number 4, with the cardiovascular intensive care unit, the typical pay rate from the agency is $53 an hour. Remember, I said we were basing this off of the $43 an hour pay rate on a regular med surg floor. So this is $53 right away. It's a $10 jump from the average right away. Number 3, pediatric intensive care unit. So while it seems anything pediatric related is hard to fill these days, it's especially true for PICU. And even more so for pediatric cardiac ICU. To locate nurses experienced in taking care of post-cardiac surgical kids, you really need RNs who have worked in the true children's hospital or highly specialized hospitals. So I've come to terms with this recently. So like I said, cardiac is if you're doing cardiac, if you know your tele, if this is something you love, you are going to be making the big bucks sooner or later. And just wait. You just wait until I get to number 1. Ooh, you can't wait. So I forgot to tell you. So these PICU nurses, they get paid an average of $62 per hour. These numbers are climbing up high, girl. These numbers are climbing up high. So they get paid $62 an hour, and that's at the PICU. And then number 2, cardiovascular operating room. So the surgical department in general is a huge revenue generator for hospitals. While most OR nurses can circulate for a procedure, finding someone experienced to scrub, particularly for specialty surgeries like cardiac transplant, neuro, and trauma, definitely raises the bar again back into cardiac. And these nurses making a little bit more than the PICU nurses. They average around $65 an hour. $65 an hour. God damn, that's a lot of money. That's a lot of change. Girl. I'm with it. I'm all about it. And then last but not least, the number 1 position where you could be making them big bucks, that big money, is cardiac catheterization lab. So finding nurses experienced in procedural areas like cath lab, EP lab, interventional radiology, and endoscopy can be a challenge for hospitals. Brudigan explains these departments are typically pretty small and not every hospital even provides these services, so the pool of potential nurses is much smaller than for traditional inpatient services. And these cardiac cath lab nurses are making $68 per hour. My goodness, thank God. Thank you, Lord. Right? Thank God I'm going to the cardiac unit. So I'm starting out in cardiac. I've been a nurse for a year, and this is my second job, and my second job's on cardiac. So I can say I'm starting out in cardiac. And I feel like the stars is the limit. Hey, I'm going through the moon. I'm making some cash money. So those are the top 4. I did want to let you know what number 5 and 6 are because it is part of the thing. Is number 5 is the NICU, and they will be making $52 an hour. And number 6 is an oncology nurse, and they make about $50 an hour. And like I said, compared to the 43, so it is much bigger, right? If you're a nurse and you don't work in a hospital, and if you're not in like the med surg, if you've been a nurse for like a week, those numbers sound astronomically high. But remember, just you have to check for based on what your cost of living is. This is an average based on that fast staffing agency. So this is not the word of the United States. Obviously, just make sure you look around your area. But those are the nursing positions that will pay you highest no matter where you are. So if you work at a PIC lab, if you work at a PICU, if you work at a cath lab, if you work in cardiovascular OR, those are the positions that you will get paid the most if you are an RN and you don't have a master's and you have some specific experience. So you nurses, go out there and make some money, baby. Make that money. Moving on. This story is specific to me in Massachusetts and also to a lot of my coworkers here in Mass, because a lot of my coworkers here are Haitian. If you live in Mass, I don't even know. Maybe this is strictly a Massachusetts thing, but c'est passé. my fellow Haitian nurses, nursing staff, healthcare providers. I've worked in a couple of healthcare related jobs, and oh my, the Haitians, they're taking over. They're good people. They're my people. Oh, they're my people. Anyways, so the Trump administration's decision to end temporary protected status, or TPS, for Haitians living in the United States will have a devastating impact on the ability of skilled nursing facilities. Reason why? I'll tell you why. Because there are approximately 4,300 Haitians who provide care and companionship to our residents. These workers include licensed nurses, certified CNAs, and laundry and food service staff. They are on the front lines daily and nightly, and their dedication is inspiring and cannot be understated. So lastly, because of long-standing government underfunding for nursing facility care, 1 in 7 direct care positions are unfilled, and this is with the 4,300 Haitians that are currently working in the nursing skilled facilities. But eliminating TPS for Haitians would undoubtedly make the situation worse and affect our ability to provide quality care. So I mean, that's what it comes down to. What it comes down to. A lot of these Haitians that come over, that are under the TPS, that are, they're here due to the TPS. If that ends, if the Trump administration decides it's over and they gotta go, we lose all of those healthcare workers. We lose some of the most dedicated, compassionate people we have in the state of Massachusetts. We lose my people. And like, it's a fact. If you're in Massachusetts, I don't care what it says, nursing skilled facilities, but I've been in nursing skilled facilities, rehab hospitals, regular hospitals. The Haitians, they're everywhere. They're taking over. And the fact that they come and they gravitate to healthcare specific is amazing. Why do we want them to leave? In fact, I want them to stay. Bring your cousin over. Bring your aunt, your uncle, your sisters, your brothers. That's what I'm saying. But no, according to Trump, we want them to go. And if they go, there goes quality healthcare. There goes the people that are doing the jobs that we need. I mean, this is healthcare. This is what are you going to do? What are you going to do? All I can say is power to the people. I want my Haitians to stay. Let's make sure that Trump does not make this TPS end. And if so, let's make sure that we get some kind of immigration policy so they can become citizens in a fast and easy way instead of having to leave and come back, and we're losing all of this care, compassionate care from some of the most amazing people I've ever met. Okay, so moving on to, this is an inspiring story. This makes me see the future that is going to be the bright and beautiful future. All of last week I was talking about robo-nurses and how technology is going to come save the world. But here is the first baby born in the U.S. from a uterus transplant. How amazing is that? So, a baby born at a Texas hospital is the first in the U.S. to be birthed from a mother who had received a uterus transplant, according to the Baylor University Medical Center at Dallas. And this is baby Vincent. If you look at him, he's an absolutely adorable baby, young, healthy, no issues. This is amazing. This is great news. This is phenomenal news. So the transplant was carried out as a part of a clinical trial to study new infertility treatment options for women who don't have functioning uterus. This could be because the women were born without the organ, lost the uterus, or has one that no longer functions. It's an irreversible condition called uterine factor infertility, affecting as many as 5% of women worldwide. 5% is a whole lot of goddamn women, and I can guarantee you many, probably the majority, but many of that 5% of women that have this uterus issue, born with, want to have kids. And this is an amazing fact that they can now have their own kids due to this uterus transplant. So like I said, this was the first in the U.S., but it wasn't the first ever. The world's first baby born from a transplanted uterus was born at the University of, in Sweden back in 2014. A 36-year-old woman gave birth after receiving a uterus transplant from a 61-year-old unrelated donor. Since then, the Swedish hospital has had a total of 8 babies born to the mothers who've received uterus transplants. So it's happening. It's not a one and done. This is not a, oh my goodness, it's like it's a miracle that has happened. It's working. So like, let me just give you the rundown on what happens to these mothers who do have the uterus transplant, because it's not like happy-go-lucky. Oh, you have a transplant, let's make a lot of babies now. Careful. It's careful. Just like any transplant, you have to make sure that it doesn't get the organ doesn't reject. So let me go down how this works and give you the rundown. So the woman selected for the study had to be healthy with working ovaries. Before the surgery, the recipient undergoes in vitro fertilization to retrieve eggs from the ovaries. Her eggs would then be fertilized in the lab with some sperm of their choosing. After that, she receives a uterus and cervix transplant from the donor. For a year after the transplant, the medical team checked to see how the recipient's body reacts to the new organ. If all goes well, an embryo is transferred to the transplanted uterus and then closely monitored until a cesarean delivery. The transplanted organ is not designed to be permanent. Again, it is not designed to be permanent, since the recipients have to take anti-rejection drugs after the first or second pregnancy. The donated uterus is to be removed. So, like I said, it's not permanent. And it's not there forever. And it said 1 or 2 pregnancies. So it's not perfect by any means, but it is so much better than where we were before, which was if you were born with a problem that you can't have a uterus, shit out of luck. You can't have babies, adopt. That's all you could do before this. Now you can get a uterus transplant and have your own babies. I think it's a beautiful thing. Let science grow. Let science continue. Let us see the day where we can have a uterus transplant and they can have babies naturally, as many as they want. I think it's a beautiful thing. I am all about it, brother. I'm all about it. So we got to talk about Children's Health Insurance Program, also known as CHIP. And this is on the more serious side. We might be losing this federal funding that many states use to insure children. Let me give you the background, and then we'll talk from there. The CHIP, known as the Children's Health Insurance Program, that insures roughly 9 million low to moderate income children nationwide, as well as 370,000 pregnant women. It covers kids whose families earn too much to qualify for Medicaid, but don't have insurance through the Affordable Care Act, or their employers. And this costs about $15 billion a year, which is a lot of money, but it's insuring children. You understand? So I'm a nurse. I love being a nurse. I think healthcare is amazing. I think the healthcare field is amazing. I think healthcare providers and their professions, angels, you guys are superheroes in like what you do every single day. But we have to understand healthcare is not cheap. Healthcare isn't, in fact, it's very, very expensive. And I understand that. But I believe we need to make a decision as a country. Are we going to look at healthcare with the number one concern being our wallet, or are we going to look at healthcare with the number one concern being the welfare of the entire country? And obviously, it's not one or the other, right? Obviously, it's somewhere in the middle, but I'm saying, what is our first priority? Is our first priority the money, or is our first priority the well-being of this country? The health of the country, from the richest of the rich to the poorest of the poor. I think that's where we need to start, and that's where the conversation needs to be. And I think, obviously, coming from me, a nurse, we need to talk about the well-being of the people and make that as efficient so it doesn't cost $1 billion a person. All right, so moving on from there. So the CHIP program ran out of money. So the CHIP program has already run out of money. It's all done. It finished. It ran out of money in September, and several states, including Colorado, began warning recipients the program will be discontinued unless Congress acts. So the letter that they got in the mail, if you are a recipient of CHIP, says, quote, if Congress does not renew federal funding for CHIP Plus by late December 2017, you will get a letter telling you when your CHIP Plus benefits will end and what else you may qualify for, says a letter from the state's Department of Healthcare Policy and Financing. that was sent to many of the beneficiaries of the CHIP program. So one of the groups that has been supporting this for the longest time, I think since its creation, is the Governors Group. And the Governors Group says the program decreased the national rate of uninsured children from 14.9% to 4.8% since it was established in 1997. That is humongous. That is millions and millions and millions of children from 1997 until 2017, and this might be ending. 15%, so 10% difference between when it's instituted and when it's not instituted. We cannot lose this CHIP program. We cannot. These are children we're talking about, children and pregnant women. Like, if we're going to take care of anyone in this country, let's at least take care of them. Can we start there? Please, can we please start there? It's not like there's no hope, because there is some hope. In October, the Senate Finance Committee approved a bill that would extend the program's funding for 5 years, but the full Senate has yet to consider it. What the Trump administration tried to do with healthcare, what the Trump administration is trying to do with the tax plan. I don't want to be pessimistic about this. I really do hope that everyone can come to the same page and say, all right, if there's anything we are going to do, if there's any program we are going to continue, they're not asking to raise the amount of money they receive. They're not asking to extend who can receive the program, like open the doors to more people. They're just asking to continue the program that was already in place, that is saving millions and millions of children and pregnant women every single day. That is all they're asking. And if there is something we're going to do, I do believe, to the core of me, as hardcore conservatives as you want to be, as financially conservative as you are, this is a program I believe most people, 90% of people, 100% of nurses, 99% of nurses would agree on. So I'm really hopeful that this will pass, but let's cross our fingers and see what happens. And then finally, to end the day like we usually do for the nurse of the week. And this is a special one because the nurse this week, Tara Neeb, she's not just the nurse of the week. She's not a nurse of the week certified but stamped by Q the Nurse on this crazy, very small, nothing YouTube channel. Tara Neeb, she's not just the nurse of the week, she's not just the nurse of the month, she's the nurse of 2017. And this is certified, announced by, pushed forward by the American Nurses Association of Michigan. And this was announced this month in December. It's the end of the year, so they announce Nurse of the Year every single year. So the annual award recognizes a nurse who maintains a current ANA membership and who constantly surpasses expectations of professional practice, has a commitment and dedication to the profession of nursing, and has had an outstanding achievement in the past year. So why did she receive it? Because she received her Master's of Science in Nursing degree. She joined the Education and Organizational Development Department as a clinical education specialist in 2014. Neeb recently graduated from Vanderbilt University with her doctorate of nursing practice degree. So excuse me, Nurse Neeb, I didn't know that you were Dr. Neeb. So that's I've always had in the comment section below, let me know. If you do have your doctorate, do you want to be called Dr. whoever, even though you're not in the medical field? I would really like to know that, because I've only met very, very few people who tell me, like I had a teacher in high school that made us call her doctor. I have no problem calling someone a doctor. I don't know, if I went to all of that school, maybe I would want to be called doctor, but it's just, when you think of doctor, you think of, when am I going to get my shots? What's my meds? Give me a prescription. You don't think of like a really smart teacher, a really smart nurse, or a smart expert nurse, expert teacher, whoever. So Neeb's primary responsibility is to onboard and train nurses who are newly hired and currently working for Mid-Michigan Health. The REACH program is a professional advancement program at Mid-Michigan Health designed to reward, recognize, and retain nurses for engaging in professional development activities. So congratulations, Nurse Neeb, Tara Neeb, Dr. Neeb, however you'd like to be called. You are the Nurse of the Week on top of being the Nurse of the Year anointed by the American Nurse Association. I'll let you guys decide which title means more. I'll vote for Q the Nurse. But, thank you guys again for watching. Again, nursing news. Every single week I bring you updates on what is going on in the world for nurses. If you guys have any ideas, topics, any suggestions, please let me know. And thank you.